for a look into what is happening on the ground there. We are now joined by Dr. Samer Attar. He's a surgeon at Northwestern Medicine and just returned home to Chicago from Gaza not too long ago. Thanks so much for joining us this evening, Samer.
Thank you very much.
So tell us about what it was like in terms of even the logistics, because that seems to be a constant here, is that it's difficult to get resources into Gaza. What was it like for you from your perspective?
Well, it's a long drive from Cairo, and then there's a wait at the border, and then you cross the border, and then you drive to the hospital.
And was it smooth enough in order for you to do that? You've been a couple times now. Has it changed?
The last time I think it was a little smoother just because we had done it before, but it still takes a while. There's just a lot of checkpoints, a lot of roadblocks, and it just takes a lot of time to get from one point to the other.
Okay. And the last time you were there for 3 weeks. What did you see during that time?
I mean, I saw a lot of people die and a lot of people suffer. Every day was heartbreaking, overwhelming, and horrifying, and every day was a breaking point.
Was it? We hear a lot about the hunger situation. Were you seeing that as well on top of injuries? But were you seeing the sort of phases of starvation really?
We were seeing patients who were malnourished. I had a handful of patients who were just very cachectic, very malnourished, who were undergoing surgery as well. And we'd see patients that were buried alive or pinned underneath rubble for hours and were just surviving by scavenging water and medical saline bottles. I remember one little girl was pinned underneath the rubble for about 12 hours, and she lost her mom and her siblings, and when she got to us, we had to do surgery on her leg in order to save it. And as we were operating, her dad was burying his wife and his 3 kids. So every patient had a story of something like that.
With the help that you were able to offer, did it feel like you could do as much as you wanted to do or as much as you needed to do? Or were there limitations based on the resources that you had in order to do that?
There were limitations because there's just only so many people to help. There was one night 2 teenagers came in. One of them required an emergency amputation through his hip, and the other one was missing skin over half of his body. And they were both in the operating rooms across from each other, and we had given one of them so much blood that the blood bank said we have to stop because we can't give all of our blood to save one life if it means not having enough for any more incoming wounded. And one of the Palestinian doctors was pleading, please just give us more blood. But eventually he said, I guess they're right, we can't give any more blood. And I remember he just collapsed and started crying because he said he was just tired of working so hard to save people only to watch them die. So we just watched this child die in the operating room of shock. And then his brother died the next morning. For the same reasons. He had just kind of reached his quota of receiving blood, and we just didn't have any more to give. So there's always, you walk away always feeling like you wish you could have done more, and there were some nights the paramedics would deliver more dead bodies than there were people to treat. So you always walk away feeling like you leave a piece of your heart and soul when you leave Gaza.